My name is Sakeenah Francis, and I'm a mental health consumer. I was close to getting released from the former Western Reserve Psychiatric Hospital in Sagamore, Ohio. After 2 months, a new government approach for long-term care outside institutions called community living came to talk and choose participants. They had 7 staff that included a psychiatrist every 3 months, a nurse that ran peer medication groups weekly, a director, an assistant director for activities, a case manager for counseling, a community worker for driving me to medical and government appointments, and a secretary keeping staff and consumers together were all in one office, and sometimes it was referred to as the wraparound program. They drove me to look for an apartment. I chose one close to the office. Then they furnished 3 rooms of furniture. The HC paid $100 monthly for my rent for 17 years. My case manager found me a part-time job. I worked at the airport as a skycap, and oh, what fun that was. I saw celebrities and actors and singers. I got tickets for things, plus I made tips. I worked for 7 years there, and I had never worked before over 7 months. And I worked 7 years there, but me being a mental health person, I thought I was doing so good, so I stopped taking the medicine. I was in crisis a year, homeless, and I missed my daughter's college graduation. Community Living advocated for me to keep my apartment. Upon release from a hospital psychiatric floor, I went to respite housing. They get you ready to return to living on your own with medicine, routine, shopping, cooking meals, and back to receiving benefits. The respite housing is gone now. Community Living was successful in my keeping my apartment. I have lived there 22 years now. All of a sudden, the bottom fell out for me. After 2 months' notice, the program stopped paying the $100 a month rent supplement and no more community living office. I am reduced to just seeing a nurse practitioner every 3 months. NAMI is my saving grace now. I have staff and consumers I can talk to and listen. Last year, near the end of the year, I lost my long-term boyfriend. He passed away. 2 weeks later, my father passed away, and neither one of them had long illnesses. If it wasn't for NAMI being able to go there and talk and listen, I probably would have been in a crisis shelter. The Speakers Bureau at NAMI now is supportive of my telling my mental health story. And to end with, my daughter and I are writing a book about my mental health, and she's talking about how it affected her. So I need support. I do well. I'm a schizophrenic. I need support with medicine, family and friends, and mental health agencies. Thank you.